Hi, thanks for joining. This is Andrew Calhoun with Amen Clinics, and I'm so pleased to have Debbie Lacer, who is going to be with us speaking about her the way that she and her practice work with counseling. Hi, Debbie.
Hello, Andrew. I really appreciate you having me on today.
So, Faithful and True, and she'll tell you more about Faithful and True of the that their physical location is in Minnesota, and she'll get into that a little bit. But they also have a global reach, and I'll let her tell you a little bit more about that in a few minutes. Really briefly, Amen Clinics, what makes us different, why we like to work with practices like Faithful and True, is that we're a multimodal approach to treatment because we uncover causes of issues or challenges that are not usually discovered by traditional psychiatry. Our psychiatrists are integrative psychiatrists, which means we work with pharmaceuticals, we work with traditional medicine, but we also work with other methods because we really think that you have to look at the biological, psychological, social, and spiritual influences to really make the biggest impact on a person's life. And that means that the treatment, after we go through our process, we give some different kinds of treatment suggestions. So we take the guesswork out of psychiatry because we want to know starting off the most about you as possible. That means when we meet with a patient, we go through an in-depth interview process to get to know more about that person and what they've gone through in their lives. That personal history then leads to the next part, which is a cognitive test. It's about 45 minutes long, and it gets us to know things like processing speed, memory, comprehension, things like that, which goes into the mix. And then there's a brain spec image, either one or two images that's taken of the brain. And the machine looks like an MRI machine, but where it's different is brain spec imaging shows not just the brain, picture of the brain, but what's going on inside. So the activity, because we want to show where your brain's functioning just right, too much, or too little. And our job is to help to balance the brain, working with professionals like Debbie. And so after that brain spec image is done, there's a detailed clinical assessment with one of our integrative psychiatrists. We meet with the patient for 2 hours, and then we have a follow-up with that patient for 6 months. And we work hand in hand with professionals like Debbie. So now, Debbie, tell me a little bit more about your practice in Faithful and True. How long have you been working with patients?
Yes. Well, I'm a licensed marriage and family therapist, and actually, Faithful and True was founded by my husband and me together many years ago. And it came out of our own recovery, actually, from Mark's sexual addiction. The reason Mark is not here today is unfortunately he passed away from cancer 2 years ago. And so I am doing my best to take the lead of our counseling center, but he was an amazing teacher and counselor, pastoral counselor himself. And I do believe that actually what we do has grown primarily because we have worked through our own process of healing from an addiction together as a couple. And I would definitely say we have been thriving in our marriage together for, it was nearly 50 years before Mark passed away. So the addiction that came out in Mark's life was over 34 years ago. So we were very much early on in our marriage when this came out. We had 3 small children. And at the time, it was very devastating to know about the secret life that had been going on. And for Mark, the pain he was dealing with, which was used sexual acting out as a way of coping with a lot of that early life pain. So over the years, of course, through our own education and our own experience of working with very gifted counselors, we developed a counseling center ourselves that dealt specifically with sexual addiction in men and their spouses and them as a couple if they chose to work on their marriage. That is our specialty at Faithful and True. And as you mentioned, we're out of Minneapolis, and we do have a global and national outreach from what we do, primarily because of all the teaching and training that Mark did in many of the earlier years of what we do. And later on, when I joined him as a therapist myself, that was a later in life change in my career, to be honest, coming out of what I really felt God is calling me to do, to serve the world and serve other hurting people out of my story. And so I work very specifically with wives who have been betrayed relationally in their lives, Mark was working with their husbands who were dealing with addiction, and then together we counseled as a couple with other couples.
And I've seen, Debbie, that you certainly a large percentage of your patients and clients you serve are out of Minnesota, but there have been patients I've seen coming from Florida or Virginia, different places, because they understand the real value and experience that you and your team bring and success that you've had with these horrible situations that people don't plan on. They don't foresee them happening, but then they can really destroy people's lives and destroy marriages and relationships. And you really help to bring those back together.
Yes. Well, you're right. And I think one of the things my husband developed over the years was a short-term intensive, a 3-day intensive for people to come to our counseling center and get very extensive help, as you said, with the Amen clinics on figuring out root causes. And that's so important. We've always felt, especially in dealing with sexual addiction, which can be seen as a very personal attack, so to speak, on a wife, and can lead to a lot of devastating beliefs about who she is in the relationship. I think for men too who are struggling with addiction, to understand there are root causes. This is not about being a bad person or just not having enough willpower. When we go after root causes, I think we're able to help someone really transform their life, which is really part of the spiritual part of what we do too. And I know you do. In many ways, our practices are very similar in that we're looking at the social, the psychological, and the spiritual aspects of getting well. You take on more of the biological, obviously, which is how we're partnering with you all. Yeah. And that really began about, 15, 17 years ago when Mark and I first met Dr. Amen. Mark was always one of those kind of on the edge of learning new things. And I forget how he knew about Daniel's work, but we were in California on a business trip, and we decided to check in with him to see if we could meet him. And he was very gracious to give us his time, and we went over, and it began a formation not only as a business partnership, but also a friendship. And so we started out by getting our own brains scanned, which was a very interesting process. And it was so fascinating to have, Daniel tell us things about ourselves without really knowing us that well at that time. And we were hooked, lock, sink, and barrel, really, with what was going on there at the Amen Clinic in California. So
it really makes a difference. As you said, I've had my brain scanned as well. And I had a traumatic brain injury more than 30 years ago, and I've made substantial changes in my diet, my lifestyle, to have a healthier brain. But like a lot of people, Debbie, I didn't know what I didn't know. And so the scan showed, and the doctor who read the scan said, there's still some things you can work on. And you're not stuck with the brain you have, you can make it better. And that's the encouraging thing from the work that you do and the work that Amen Clinics does, is it's never too late to work on some of the challenges that a person may have, even if they think they're deep-seated, deep-rooted. There are issues from my brain trauma that I didn't know were still going on, which is a reason for why I may have done some things and have some thoughts go through my brain. And so I now take a natural supplement from Amen Clinics that helps to work on that particular part of the brain. But I wouldn't never have known had I not come in and had the scan done. But that's something I wonder if you could talk a little bit more about, Debbie, is when people say, gosh, am I beyond repair, or it's too far gone, I've done too many bad things. And that's certainly not the case.
Yeah. Well, I think that's where our spiritual influence is so important in what we do. We believe God is never finished with us. And it doesn't matter how old we are or what we've done. We live, our belief is we live with a gracious God who will forgive us for things that we have done, and also encourage us to grow and learn something out of the pain we've experienced. We have this belief that there is purpose in all of our pain and in all of what we do, and we can learn from that and change our character, and our growing closeness and dependent on someone who is always believing that there's something more for us to become that person that he created us to be. And, second chances are what we see all the time going through our counseling center, of people who have taken their second chances and turned their lives around and really transformed who they are as a person. And I think it's not only an individual transformation, but it can be a transformation in all your relationships and all your roles. Sure. I know, even though I wasn't struggling with addiction, having entered into this process and knowing all of these things about myself that I did, I began to learn so much more about what it was like to become more Christ-like in my life. And that changed my role as a mom, as a wife, as an employer, as a friend, as a daughter. And I do what I do because I believe that for all the people that we work with too. Adding this dimension of understanding more about how our brain functions and influences our behaviors and our thoughts has just been an added piece to understand root causes of things. And that's why around 15 years ago, when we met, Daniel, that Mark and I became very excited in adding that piece to what we do in our treatment protocol with our clients. I wish everyone had the resources to have their brain scan before we even started with them psychologically, but unfortunately that isn't possible. I know you've created a lot of ways that we can take a look at maybe what's going on in the brain through assessments, and we'll be doing some of that. But when our clients can't afford to travel to one of your clinics, we are definitely recommending that, as it's not unusual for both husbands who might be struggling with addiction and their spouses to be struggling with anxiety or depression. Over half of our clients are struggling with ADD and undiagnosed ADD, as you all have proven in your research projects as well. I think your percentage is even higher than that. We have many that struggle with sleep disorders, OCD, and a lot of times, as you said, we don't know how to label those things, or a person doesn't know that there's a problem with that because that's what they've lived with their whole life.
That's their normal, right?
That is their normal, for sure.
Well, tell me. I know there's no typical patient, but if a person, or if someone were to contact your practice and say, "I think I might be interested," how does that work? What does the process look like for a person?
Mm-hmm. Well, for those that are right in the Minneapolis area, we have a clinic with around 10 counselors that work for us there, and we serve people out of our counseling center personally. Of course, a lot of that's been on Zoom lately, but we're back to mostly in-person work with our clients. We offer individual counseling for those that come to our center. We offer marriage counseling, and most importantly, we offer groups for those who are involved in those ways with our counselors. And just as you believe in the social aspect of healing as well, I think what we have come to say to people who are recovering from addictions is a community, safe community with other people is essential to healing. We don't just offer it as something that's rather nice, but Mark and I experienced that early on in our recovery, which was very unusual at that time, 30 years ago, to have professionally led counseling groups. And out of that, we formed what we do at our center by offering many, many groups for people that come to us. It is that doing work in the group of other safe people that allows you to know some things differently. You know, as you were saying, when our normal is what we have lived with most of our life, a lot of times we don't know that something that we considered normal is not that normal for everyone else sitting in our group listening to our story. And it's very helpful to learn some of those things that way. So we do offer that. For those who are outside of Minneapolis, we primarily encourage them to come to our 3-day intensives, where we have poured into our clients who come just tons of information that we have put together for the healing journey, and also an opportunity in developing their story all the way from birth to the present, which for many of them has had many pieces of it being secretive and parts of their story they've really never shared with anyone.
And what I love to hear there, Debbie, is that you have the professionals who work with you there in the clinic, and you organize people so they can come together in community, and so that they can find, because it's so important that people don't feel alone. And I'm sure a lot of people feel like I'm the only person who, none of the people I hang out with, none of my friends, no one else is having these challenges. We don't know that. They don't know that. But then when you put them together with other people who are having similar challenges, they can say, okay, so I don't feel so wrong. I don't feel, one of the things that we're big at saying is getting rid of the stigma, because someone's having challenges, and people will say, well, that's because it's behavior. Well, it is behavior, but sometimes it's driven by what's happening up there. And if you can help to correct one of the ways, when I first started working in Amen Clinics, it was explained to me that we try to work on the hardware, where Faithful and True works on the software. We're trying to get what's going on up there right, so you can have the right nutrition up there, the right kind of sleep, healthy sleep, get rid of the toxins, so that the brain and the body and spirit is ready and willing to absorb the help that comes from practitioners like at Faithful and True. But going back to this community, that to me is a critical part, so that people don't feel alone. And you can say, a one-on-one counseling can say, you're not alone. But then when you bring them together with all the people, they say, you're right. Here's someone else I had never have met, but they have the same challenges that I've had. So that's a great addition you've given.
One of the things I love about our workshops that does bring people in from all over the country and even outside the country, as you said, globally, is they get a chance to meet all these wonderful people, because they are wonderful people and they're dealing with an addiction. But we bring these people together, and, we have many all walks of life, from pastors to teachers to lawyers to businessmen to agricultural specialists. I mean, you name it, we have them at our center. And when they come in and meet each other and realize, we're not just the scum of the earth here. I mean, it's not that there's something the matter with us as our personhood. We have been facing a lot of pain in our life, and we need to understand what that root cause is. And as you said, when we put that together with a well-functioning brain and body, we have a much better chance to thrive in our recovery and not just survive. Surviving for us is more about just stopping a behavior, but not working on the transformation of all the other hardware and software that we have available to us. And so for those that really thrive, it is a longer process, and actually a lifelong process. We believe, in terms of the spiritual growth, we're always working on that part as long as we're here on earth. It's like this is our dress rehearsal, so to speak. Right. And there's always something more. Even now, after 30 plus years of being in a recovery program myself, I'm still finding out new ways that I want to change and grow and be the person God created me to be. So we like to think of a lot of what we do as helping people along that spiritual journey, even once the addiction is under control and it's really not the main issue anymore. We're able to walk with people on some of the other changes they want to make in their life. And that is often where we want to include Amen Clinics. When couples or individuals get stuck with what we normally are helping them with, we almost always recognize that the hardware problem for them is such a problem. We really can't move on without trying to solve that. And like I said, ideally, that would be looked at first thing. I know some of the folks you work with have been able to do that. That would be my goal one day, is to have that be one of the initial things we're able to provide for clients that come to us.
Right, sure. Thank you, Debbie. And one of the things that brought to mind is that people should understand that not to explore and to reach out to you or to Amen Clinics to see if it's a good fit. We find that we're tremendously successful. We have 85% of the people who come to us find significant changes after leaving Amen Clinics and following through with the treatment suggestions that we make. But we also find that the average person who's come to us has already been to 3 to 4 therapists or doctors and haven't found enough of the answer. And that's because they don't know what they don't know. It's not that if someone came to me and a very prestigious hospital that's world renowned, that's in your state of Minnesota, and the patient's mother said, "Oh, well, we've already seen 4 therapists, and we go to this very prestigious clinic that you've heard of. People come from all around the world, and they couldn't help my daughter." I said, "They're fantastic physicians and therapists at that clinic, but they don't know what we know. They don't have the same process that we have." And so that's why people need to explore different avenues to sometimes to get what their end result, achieve the end result they're looking for.
Yes.
And so I really encourage people to reach out and not feel that they have to go it alone, not feel embarrassed or shamed, because it is a shaming thing for sure. There are a lot of whether it's a sexual addiction or a substance abuse addiction or something else, it's a shameful thing when a person has the realization, I shouldn't be doing this. I'm embarrassed. But that's exactly the time when you should reach out to Faithful and True or Amen Clinics. And that's so I'm happy that your practice is continuing to grow, that people are realizing this and really coming to terms with there's help out there.
Yeah. Do we have time that I could share a short story about my family?
I'd love to hear a story. Yeah.
Well, as I said, over the years, I mean, I've grown more and more enamored with obviously what goes on at your clinic. And I do want your listeners to know that there's nothing in it financially for us when we refer people to you. That would be important to know. I do it, and our other clinicians do it because we so believe in the work you do and how you help people. But a number of years ago, when my dad was still alive, he had gone through triple bypass heart surgery and had fallen into a depression after that, which we often hear is not that abnormal for someone coming out of that surgery. He was seen by various doctors and tried any number of medications to try to help him. And I would want you to know that my dad was a very jovial, very engaged in life, outgoing man. After 2 years of watching him struggle with depression, I said, Mark and I said to him, would you be willing to get your brain scanned just to see what's going on? Because you're just not yourself. And he said, absolutely, anything but what I've been doing. They put me in something, they take me off something, they try something else. And so he went and had his brain scanned. And this was, how many years? 15 years ago or so, not quite that long. And when his scan came back, what Dr. Amen noticed about his scan when he reviewed his scan was that it wasn't depression really that was his problem at all. It was toxicity from all the anesthesia that he had, not only from that surgery, but 2 prior shoulder surgeries that he had had. And when he saw the toxicity in his brain, his protocol for treating that was very different. Within a month, my dad was my dad.
Wow.
And it was amazing to watch. So in addition to that, I have family stories about my daughter who has adopted 4 foster children when they were very young. They could tell fairly quickly that they were struggling with potentially ADD issues. We brought the whole family out to you to be scanned, all 4 children. They all had different subtypes of ADD. Their treatment protocols were different. And I would say, I would want you to know today, they're 19, 18, 17, and 16, and really doing well in life. They've been adopted. They're on treatment protocols and doing extremely well.
Well, thank you for bringing that up, David, because some people might not know. I didn't know before I started working with Amen Clinics, when I had actually a patient or a mother call in and said, my son has ADHD. I said, which type? She said, the normal type. I said, well, there isn't a normal type. There are 7 different types of ADHD. There are 7 different types of depression. She said, what do you mean? And that's where your philosophy and our philosophy differs from maybe traditional mainstream, which is, if you look at we're not just treating symptoms. So if someone comes into depression to some other doctor's office, they might say, well, try this medication. If it doesn't work, we'll try something else. We don't like hit and miss. We want to be able to look at that scan and say, we've done 100, you know this, Dave, we've done 180,000 scans of people. And so we have a great library, in fact, the largest library of scans in the world to draw from to say, your scan looks like this. And that's exactly like what these other scans look like, which show this kind of ADHD. And for that kind of ADHD, it's this kind of medication, it's this kinds of supplements, this kind of diet, which will really help to change the course. And it can happen so dramatically quickly if you're on the right, if you stay compliant and you do the right things. It's not a shot in the dark. And like similar to what you do, it's not just come in one time or two times and you're finished. There's a process, and that's something that I know you're big on. Is let's talk this out. Let's get you on the right path, and let's keep going to continue your healthy life.
Yes. Well, I have to tell you, in my licensure, of course, I need to acquire CEUs every year. And so I chose to do the professional brain certification class that I just finished all of the teaching. So I've been listening to all of you for hours and hours and hours. And I am more on fire than ever about what you all do. And I just wish I wasn't quite as old, that I had a few more years to maybe include in my career path more about how to be involved in brain imaging, but to the best that I can do in my practice and encourage people to come and think about that part of their well-being, I will definitely be doing that.
Well, thank you. The Brain Health Professional course is a tremendous course. I just started, and it's a lot of work. It's at least 50 hours of work. It's very comprehensive. My fiance is halfway through. She's a wellness coach. If anyone who's listening wants to get more information about the Brain Health Professional course, or other things that Amen Clinics does, they can contact me, and the contact information will be down below, because we're best known for the process that I summarize of the scanning and evaluation. We also have Amen University with a lot of educational programs. We have some things, as you mentioned at the beginning, Debbie, which are free, some assessments, ADHD assessment, memory assessment. One of the newer ones is the Dragons assessment, based upon Dr. Amen's latest book, Your Brain is Always Listening. That's a fun one. And these are free. They take about 5 minutes. They're anonymous. And so it's a good, there's resources that we have. Some cost money, some don't cost money. Another thing that I'll just add in, we have the Brain MD supplement line. It's a very high quality. When we talk about supplements, a lot of people say, I'm taking a multivitamin or vitamin D. There are vitamin B, whatever you're taking. Make sure that they're good quality supplements, because they're not all made the same. So be conscious of the choices that you make when you buy supplements. Brain MD is great. We're not the only good company out there. We have really good quality, but make sure you buy good quality when you have those.
Mm-hmm. Yeah, I would say maybe this is in closing, that over the years that we've been connected with Daniel and all of your work at Amen Clinics, is that he has continually progressed towards trying to promote natural healing for the brain and for this hardware, as you say. And that's very evident in not only, the social, psychological, spiritual aspects of healing biological issues, but also in terms of exercise, meditation, supplements, nutraceuticals, and medications being like one of the last resorts. And I love that about your work, because I think if I did have another lifetime and another career to choose, it might be to go into integrative medicine, because I so believe in some of these natural ways of providing healing for our bodies and our minds. And so I'm really thrilled that you offer so many of these kinds of things on your website. Some people might think it's just a business to be a business, but what I know is it's a whole change in psychiatry for Dr. Amen, and what you do there is wanting to heal the brain as naturally as possible.
Thank you, Debbie. And the contact information for Faithful and True will be beyond this webinar. So I encourage you to reach out, even if you just want to reach out to ask questions and not sure, maybe it's right for you, maybe it's not. I'm sure that they will give you some answers and some insights, as well as for Amen Clinics. You can reach out to me directly, or you can call the Care Center line. We're open most of the day to answer questions. people who are trained, not just to answer phones, but to really knowledgeable about brain health. Thank you so much, Debbie,
You're
for
welcome.
sharing about Faithful and True. It's a real pleasure.
It's a pleasure to be with you too, Andrew.